Hi and welcome back to the channel. Today I'm bringing you a very interesting case of TMJ dysfunction. If you work with acupuncture, I'm sure you've seen a lot of TMJ related cases. This is something that the patients come to acupuncture a lot for, and we're talking about difficulty opening their mouths, pain when they're chewing, pain when they try to open their mouths. Sometimes we see tinnitus associated with TMJ dysfunctions, we see headaches, we see cervical pain. This is something that we see a lot. And it's something that can create a lot of problems for the patient, so it's very important for every acupuncturist to be comfortable dealing with the different presentations of TMJ problems. We know that when we talk about TMJ problems, they can have many origins. It can come directly from a problem with a joint, it can come from overuse, it can come from cervical problems, it can come from problems related to the teeth, can come from emotional issues, and a lot of times we see that it comes from a combination of different factors. But regardless of why this happens, it's very important that we're good at treating it, because it's a problem that we see a lot, and it's a problem that creates serious issues for our patient. And that's why I'm bringing this case today, because I think it's a very interesting case that illustrates how we can help our patients with distal acupuncture and bloodletting techniques, even in more complicated situations like TMJ dysfunction. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases, so if you want to learn about it, check them out. So let's dive into the case. This was a female patient, 35 years old, and she arrived at the clinic complaining of TMJ problems that have been going on for more or less 3 weeks. When asked the patient if she knew what caused the issue, she told me that this started when she had a fight with her father, who is very important in her life. So she had to tell him no, and this was bothering her. And since that fight, she started having pain in her TMJ. Well, the location of the TMJ plus this description automatically pointed me to think about gallbladder issues, because we know that the gallbladder suffers a lot from emotional issues, and that it's a very integral part when we have to say no to someone we like and all of that. So that pointed me towards the gallbladder. Plus, we know that the gallbladder meridian goes around the TMJ. The patient had pain mainly in the area of the joint going all the way to her ear, and she also complained of frontal headaches that started when the TMJ problem started. So, as for the TMJ, I was thinking about gallbladder, maybe something else related to the ear, possibly small intestine, but I had to test it, and frontal headaches. Usually we're thinking about yang ming, so large intestine, stomach. During the rest of the diagnosis, we could see a lot of wood-related signs with the patient. So she had a wiry pulse, she had teeth marks on the sides of her tongue, but not from a swollen tongue, more from pressing the tongue against the teeth, which is a very typical sign of overactive wood. So you could think about wood being overactive. Another secondary complaint that the patient had was problems with her sleep. She said she had a lot of very vivid dreams, and that she would wake up many times during the night, and also that she would wake up tired, so she wouldn't rest during her sleep. And this, along with what I saw in her pulse and in her tongue, pointed me again for problems related to the wood, both gallbladder and liver. So as main affected channels, we had gallbladder, liver, possibly Yang Ming, and maybe small intestine, but for sure gallbladder and liver. In order to start the treatment, I started with a point from Master Tung that I love every time that we have TMJ problems, especially if the patient has difficulty opening her mouth, which was the case with this patient. She couldn't fully open her mouth, not only because of the pain, which was a lot, but also because she felt like it was blocked. So my first approach was using Herbay. This is a point in the ear that belongs to Master Tung's acupuncture. As you can see here in the image, this point is located in the upper third in the back of the ear of the patient, but I don't use the classical location. What I do is I look for a blood vessel around the area of this point and I do bloodletting on this blood vessel. So I took a few drops of blood from her Herbay on the same side of the pain, so left side. As soon as I bled the point, I asked for the patient to open and close her mouth and see if there was any changes, and the patient was flabbergasted because she told me that she felt no more limitations in the range of motion. So she could open her mouth fully. She still had pain, although less than in the beginning, but the limitations of movement were completely gone. So I decided to start working on the pain. And the first thing I did was triple warmer 3 on the opposite side. Well, this is simple balance method approach. If I'm treating gallbladder, I can use system 1, so I can treat it with the triple warmer, and I can use the hand to image the head. Along with this, I also added the point 22.05 or Lingu. This is a Master Tung point that is very close to large intestine 4, so it will be great to treat a Yang Ming type of headache, so frontal headaches. This point also has the indication of treating headaches, and just as a curiosity, it is on the large intestine channel, so amazing to treat Yang Ming problems, but it also has the Shenjing of the channels from Master Tung of the kidney, heart and lung. After I needled these 2 points, I asked again for the patient to try and feel her jaw, feel her face, see how opening and closing her mouth. Does it hurt? Does she still feel tension? How's the headache? And the patient told me that the headache went completely away. The pain in the jaw reduced, but there was still pain and tension when opening and closing. So I added another point, 66.03 on her right foot. This point is called Ho Ying or heart fire, and it's located on the liver channel. This point is close to liver 3. This point has the indication of problems related to opening and closing the mouth. Plus, being on the liver channel, the point can balance the gallbladder, and being on the foot, it can balance problems on the face. This point also has the Shenjing of the heart and the liver. After adding this point, the pain went almost completely away. The patient still felt some tension when opening her mouth, and when using the full range of motion, at the top of the range of motion there was still a little bit of pain, but almost nothing. The one thing that wasn't going away was the pain in her ear. So I decided to go back to the right hand and add small intestine 3. This point is amazing to treat the ear, and again, the hand is a great image for the head. As soon as I added this point, the pain in the ear went away. So now I just had to deal with the tension in her jaw and the last little bit of pain. What I did was adding gallbladder 41, which is the guiding needle for the gallbladder, and I also tried to add 77.22. This point is called Sun Li. It's very close to stomach 36, but it's between stomach and gallbladder. This point has the Shenjing of the lung and the teeth, and it has an amazing action all around this area of the face. After adding these points, I asked the patient again to move, evaluate the pain, and the patient said that she didn't feel anything else. So no more tension, no more pain, no more limitation in the range of motion. So the left side and the right side felt exactly the same. I could have finished the treatment here, but I decided to do a full global balance for liver and gallbladder in order to try and help also with her sleeping problems. So if you look at the points we already have here triple warmer, points in the liver meridian and points in the gallbladder meridian. If I just added 1 point on the pericard channel, we could close the global balance, balancing Shaoyang and Zhuiyin, which is great for overactive wood and problems relating to that, as was the case of her sleeping problems. So I used an Ashi point in the area of pericard 3. And like that, we close our global balance. Just to finish the treatment, and because the patient was still feeling a lot of stress from her fight with her father, I added Yin Tang, which is a point that I love for situations related to emotional stress. And the patient left without any symptoms. I saw the patient 1 week after this treatment, and her feedback was that for 1 full day she was completely without pain, but then the pain started coming back. She had no limitations in her range of motion, but there was some pain and some tension, although less than before the first treatment. The headaches didn't come back, but she still had some pain in her ear. As for the sleep, the patient registered that her sleep was better and that it was in fact gradually improving, so every day she would sleep slightly better than the day before. So I decided to keep the same treatment. I just removed Herb A. First, because I don't like to do bloodletting every week on the same spot, and second, because this point is mostly for the limitation in range of motion, which was no longer there. I also took out Lingu because there was no more frontal headache, but I kept all the other points. Again, the patient left without any symptoms, and I'm going to see her again next week. I'm hoping that we will see a steady improvement, so maybe 2 or 3 days without any pain, and again when it comes it will come back even weaker. I know that I say this in almost every video, but it's really important for me that you understand how important these techniques can be for your practice. So distal acupuncture, especially Master Tung, and balanced method acupuncture are amazing tools. Bloodletting is an incredible tool, even for hard situations, even for hard cases that are difficult to solve. You will see improvements, and these techniques bring you 2 very important things. First, they bring you the confidence that you're almost certain that you're going to see results in the first session, and second, they bring you the quickness of action. So the patient, in my opinion, should always leave your treatment table better than he was before he lied down. And with these techniques, you can almost always get this. But it's not just have a quick result and then the pain comes back. As you can see, we have a steady improvement along with the very quick results. This is amazing for your confidence and also amazing for your patients who are seeing results in real time. So if you still don't work with these techniques, try and find a good teacher to learn this. Read books, watch YouTube videos, do in-person classes, online classes, but if you're serious about getting good results with acupuncture, I think learning distal techniques and bloodletting are a must for you to be a top-level professional. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel, and share this video with anyone that might benefit from it, and I'll see you in the next one.